Ms. Morrison, welcome. We're standing at the Hope Conference in The Hague. In Dutch newspapers, patient safety, we read a lot about it, especially if things go wrong. What is the situation in Scotland? Is it in the media as in vogue as it is in Holland right now, patient safety?
Yes, it often is in the media, often for the wrong reasons, but certainly within Scotland we are very keen and clear to have patient safety as one of our strategic priority areas for improvement. So yes, we are very much driving forward this agenda.
Okay. And what is your role in improving and bringing further patient safety?
Okay. I'm here today from the Scottish Government. I'm a nurse. I've worked in the health service for 25 years, and my job at the moment is to lead an improvement programme in the management of adverse events. We found ourselves with some areas that we thought we could identify some improvements within Scotland, and we were very clear that we wanted to have an improvement programme that looked at having a national definition for an adverse event and a nationally agreed approach to the management of adverse events that very much had patients and their families, as well as staff who were involved in adverse events, so that we had a more clear and consistent approach to the management and learning from adverse events.
Okay. Do you think there are other European countries who have experiences that could be helpful to you?
Very much so. We've looked at a number of countries, particularly the US. We've been working in Scotland with the Institute for Healthcare Improvement for a number of years. We have a national 5-year programme which has recently just been extended to the Scottish Patient Safety Programme, which has a number of work streams looking at patient safety. Initially that was in an adult hospital setting, and that's recently been extended to maternity, primary care and mental health settings, so patient safety is a key priority for us here in Scotland.
Okay. And are there any concrete goals connected to this programme?
In terms of our management of adverse events, we are looking at measures. We're looking to identify what are the right measures for Scotland. At the moment, there's a piece of work that's being taken forward over the next 12 months that does look at a measurement programme as to that. So that will be the identification of process measures, outcome measures, and what and if any balance measures we need to consider. The national Scottish Patient Safety Programme does have measures associated with that.
Okay. As far as I understand, Scotland has a national health service. Is that of any influence on this adverse event programme?
So absolutely, we have a national health service. We have care that is free at the point of delivery. Patients go to their local hospitals for their local health care. We are very much trying to move healthcare into what we would describe as away from the acute hospitals into a more homely or in patients' home. So we're looking at a variety of different methods to manage healthcare safely to meet the needs of patients and their families and the wider local population.
Yeah. What does the population in general think about patient safety? Is it for them an issue too?
Oh, very much so. We do have patients who are thoroughly and well engaged in this, because actually this is the purpose of this patient safety programme. It is for patients themselves.
Okay. Thank you.
Okay.
Thank you.